Hey everybody, thank you so much for joining us on the live stream. We are really excited here. We are in one of these interdisciplinary rooms right around the hospital. You can see out the window here, we've got the Big West Edition here in Grand Rapids, and we got a full table, full room here of staff and volunteers, and it's just really exciting to be talking today. So Mary Free Bed has a really long history of utilizing volunteers, and we were founded by volunteers. Today, Mary Free Bed still utilizes our volunteers across the system, and they support us in many ways, a lot of times behind the scenes in clinical spaces and beyond. And we offer lots of different types of positions, just general volunteers, college student volunteers. They can get a full semester here, and they can help them actually become clinicians, which is really great. So they get some great experience and insight into their chosen fields, as well as some great volunteer hours, which we'll hear about from our guests. So it's a happy extension of this program for some, and it's a great start to their career at Mary Free Bed. And we're excited to learn more about that. So on our panel and our group talking today for the live stream, we've got Chris Shannon. She is a volunteer services specialist, kind of running our volunteer team, right?
I am all volunteer all the time.
Yeah. And then we've got Jenna Carlson. She is a current volunteer. This is her third time through, and I heard there might even be a fourth coming up. Mm-hmm. Awesome. And she is a second year at GRCC, Grand Rapids Community College. Shout out right there. And joining us also right down from treating patients, we've got DJ Mott, rehab tech on our inpatient team. He is working on the spinal cord team, and he's here because he was a volunteer.
So many moons ago.
So, Chris, let's get us started and I kind of introed it a little bit, but tell us more about the Mary Free Bed volunteer programs.
Okay. Well, we've utilized volunteers since we started in 1891, and we're not going away. We basically have two different categories that we utilize volunteers in. The first one is what we call general volunteers, and those are the volunteers that are kind of throughout the year that we utilize. They help with everything from guest services. They could be a greeter, a wayfinder. We have people that help with our pet therapy teams, that they visit the patients that are in their rooms. You know, you might be here for a week or two, you're going to miss your dog. It's sometimes nice to get a little doggy time. And then sometimes we have volunteers work with our wheelchair and adaptive sports groups. Sometimes they'll even help with like the swim lessons. They might do the tournaments. There's tons of areas. We have people behind the scenes also. I don't know if people know this, but we have sewers that help with our hospital. They make all the leg loops. They make wheelchair bags. They make walker bags. Anybody who is here can go home with a handmade bag, which is kind of cool. So lots of areas. I probably missed a couple, but I don't want to forget the other area of volunteers, which is our college student volunteer program. And that is an area that's really, really growing, which is exciting. We have so many colleges nearby, and a lot of them in health sciences, and we're really trying to attract more and more of the college students here because it's just a win all around.
Yeah.
The volunteers are going to get their experience. They just want experience for themselves. Sometimes they want hours for like grad school applications. They might need it for a certain fieldwork class, and just getting insight into what they're trying to do. And then on top of that, the hospital is getting help. I like to think that college students, whatever they're doing in the gyms, is taking the time that a therapist would need to do that. They're giving that time back to the patients. So it really is huge. And it's great because down the road, they might want to become a therapist. They might want to become a nurse. We offer different areas, and we're growing that, and we're hoping we're going to get more and more people starting in a pipeline to maybe start an actual career with us, and we'd love to think that they started here at Mary Free Bed.
That is so great. And that's why we're talking about it today, because the summer session for the college student volunteer program is just opened up. So that's why we were talking about it now, to raise that awareness. So DJ, we're going to go back to that many moons.
Yes.
How long ago was it that you started volunteering here, and what drew you to it?
Yeah. So I want to say it was about 2 years ago now.
That's not that many moons ago.
It feels so long. Well, I feel like once you get here, like the people that you meet, like you feel like you've been here for forever, just how open and welcoming everybody is. But I was actually wrapping up my undergraduate career, and kind of moving on to next steps. And one of the things that my advisors recommended I do was, give Mary Free Bed a try. It's volunteering, so you'll get some good experience. And I wasn't too familiar, not being from the area, I wasn't too familiar with MFB, so it was another opportunity to see something different and it was pretty much right after that I was like, oh man, I'm hooked. I'm hooked.
Awesome. That's great, DJ. And Jenna, so what attracted you to here? This is your third session going on, fourth time here. What drew you to Mary Free Bed?
So my story started a long time ago. I came here through KCTC. They had like a talk-in tour that you could have a panel of people with a variety of careers that would talk about what they do and their day-to-day job. So I was 14 at the time, and I just knew that I wanted to come here at some point in my life. And I was really drawn to the orthotics and prosthetics, ironically. And now that I'm in college and I heard about the college volunteer program, I joined when I heard that orthotics and prosthetics had openings for volunteers. And yeah,
And
ever
we were
since then.
we were talking before we started recording, like that's now that your time there, like you know that's what you want to go into. Like,
Yes,
it has
yes.
impacted you that much, like that's your career you're going to go into.
Yes, for sure. It's definitely confirmed it.
Oh man.
Yep.
And so DJ too, like your we're talking about this and finding out more about what drew people in here. So Jenna, we're kind of getting to this too, but like what did you like best about this volunteering? What was been your favorite part, that makes you keep coming back?
I think that's hard because I really enjoy all of it. Like being able to see a patient being casted and then going across the street, watching it being fabricated and made, and then watching them try it on, walk for the first time. Like, I don't know. I just love meeting new people and meeting the practitioners and the patients. It's just so rewarding.
That's awesome. DJ, what about you? What was your favorite part back when you were volunteering?
Yeah, so I was an outpatient peds, and that was one of those things where I was like, I was on the border of, do I want to is pediatrics kind of the path I want to continue to pursue? And I really just enjoyed the patients, like meeting. There was no one same case, like you didn't treat anybody the same, and I really like that it is so personalized here. Like everybody gets their own special thing, and that's so cool.
How often, Chris, is this the feedback that you're getting from your volunteers? I mean, this is just they're loving this, and they keep coming back.
It's very consistent. We get overwhelmingly positive feedback. I get students that have said, wow, I never even considered this or that. Their time here is opening their eyes to all the aspects of what people do. You think of a hospital, it's going to be a doctor and it's going to be a nurse. Maybe they didn't know too much about rehabilitation, but this is showing them all the different ins and outs of it, and they're getting hooked on it. And that's why I'm glad to say a lot of the students come back for more than one session, because they want to either get more, or maybe they want to tweak and do a different department and get a more well-rounded experience. But it's just, we get people that are really excited about being at Mary Free Bed, and I think it's just because of what they talk about. It's a good feeling that we have here. We feel like a real team, and the students really enjoy their time with us, I'm pleased to say.
Yeah, I just to jump off of that, like that's exactly what I would say. Like everybody who I've talked to, they're like, oh, I'm going to be coming back. I might not be able to come back this winter because of my class schedule, but you're going to see me in the summer, and I plan on being on this floor, or I plan on doing this. And like just seeing like that they want more, like they want to see this, and that's so cool.
Yeah, and that's the beauty of the program, is that it's a semester long, but you can do as many sessions as you want. I think we might have somebody coming back for a 5th semester with us. So they are really getting the whole shebang here. And that's exciting because, some people do it. They want one experience, that's fine. But if they really want to dive into it, they can do more. And I've actually had people say that they've kind of switched gears, kind of what DJ was saying. He was on the border about what he was going to do. Some people have had their time here inform them to go into a different direction in rehab that they didn't even know existed when they started. So that's pretty cool.
In your introduction, you kind of talked a little bit about those different directions and ways that people can volunteer, but can you walk us through just like all the different type of volunteer roles that people have in the different areas around the hospital?
For the college program?
Yeah.
Okay. Well, I'm glad to say I did some counting on this, so I would be informed for this interview. We started out with 6 different areas in the program, and we are now offering 12 different areas. So it's not only different disciplines of therapy, but it's also different locations. So right now, volunteers can work in our outpatient gyms. They can work in our inpatient gyms. They can work for nursing nursing, and we all know there's a lot of nursing students out there. They can work in O&P, they can work in rec therapy, they can work in our Holland location, they can work in our Kalamazoo location. That's just starting this summer. And then we have 2 locations at the Y, the Mary Free Bed Y and the Spartan Nash Y. So there's really quite a lot of variety depending on what you want to do. And it also helps to accommodate different schedules because students are busy people. So hopefully we have something that works for pretty much anybody that's looking to come into a hospital like ours.
And DJ, you're just such a great example of this, about how the volunteering can then impact your career. I mean, because you're a current employee now, like, how did this volunteering help you like transition into this role?
Yeah, so I had been in similar roles to the rehab tech at other locations and other companies, and I really wanted kind of that next step. And I would say that, here Mary Free Bed uses their rehab techs pretty uniquely compared to other places I've been. And I really like to see that, like, this is a hands-on position. You're gonna be getting, you're gonna see, you're gonna feel, you're gonna give your opinion loosely.
Yeah.
you're gonna be in it, and that's what I really loved about it. And that's kind of where I was asking my rehab tech, my person that was ahead of me, what can I do? Like, is there any positions, is there anything I can do past volunteering just so that I can be around this more?
Yeah.
And lo and behold, there was a spot open.
So Jenna, we talked so much about this too. Like, for you, how has this volunteering like helped you in your career future? Like, you've picked the area you want to go into, but has there been other parts of this that you can see furthering you as you're growing into an adult, into a career?
Yeah, for sure. Like, personality wise, it's definitely made me a more rounded person, like practicing kindness and empathy in everyday life, not knowing what other people are going through or what their loved ones are going through. And then career-wise, the practitioners have allowed me to use my hands and have offered me like different things to do around the sorry. Trying to think
Like
of the
in the
word.
lab.
Yeah, like in the lab, they let me do some stuff. So, yeah, that's really helped me be more confident in my hand skills relating to the field.
That's awesome. That's great. And I bet that was pretty cool the first couple of times. I love walking back in O&P and
Yeah.
seeing, we can call it like Santa's workshop, seeing how everything is made. It's such a great experience to walk back in there. Chris, how common is DJ's story, being a volunteer, becoming an employee, and then also Jenna, this multiple back times here in, hopefully maybe becoming a Mary Free Bed employee at some point
We
too.
hope.
Yeah.
DJ story is very common. I would say at least half of our techs started out as volunteers. And what's amazing about that is it means that we must be doing something right. They really love what we're doing. They want to continue to stay with us in some capacity. So they become an employee. And what's exciting about that also is that oftentimes the techs are also the contact person for the volunteers in the gym. So it's perfect because not only are they moving into a role, but you also understand exactly what the volunteers are going through. You know the type of duties they need to do. You know the type of things they want to do. You are a perfect person to direct them during their shifts. So it's kind of like a double win on that. And when you talked about the multiple times, I'd say we have at least 15-20% of our people every session that are returning students, which is really great. It means that, like I said, we have people coming back for the 4th time. I think we have one for the 5th time. We must be doing something right. And it feels good to know that somebody wants to know more and more about what we do as a hospital.
So DJ, she's talking about this, like, so you are also interacting with these volunteers too. So
Yes.
what's that? Feels pretty full circle.
Yeah. I assist Chris in kind of giving the orientation tours, myself and the other techs on the team as well. We all work together to facilitate. I like to say we facilitate learning, because that's the goal. That's what volunteers come here to do. They want to learn, they want to absorb all the information that they can, but it can be overwhelming. So having us there to kind of guide and say, this is what I was doing, this is what I did, I feel like has helped a lot.
Chris, what have been some of the other, types of roles that people have gone into after they have volunteered?
Okay. I know we've had several guest services staff started out as volunteers. They proved that they could really do it, and they got hired as staff when positions opened up. Also, we've had volunteers that have turned into interns, and then we've had interns that have turned into employees.
Okay.
So that's really cool because they're really starting as a college student. They're getting their feet in the door and they're moving their way up. And I know some intern we've just had actually has just been promoted to a manager. So
Oh, wow.
there really is growth in the system for somebody that starts out with us at a college level.
That is awesome. So Jenna, I mean, with this, you've come back multiple years, what would you say to somebody who's maybe interested in going into healthcare and they never thought about volunteering?
I would say shadow as much as you possibly can. I know Mary Free Bed offers a career seminar that was very helpful to me. And it's sometimes about who you know, not what you know. So just getting out there, meeting new people, that's probably the best advice I could offer.
And DJ, now we're kind of hitting this advice part of the conversation. What would you say to somebody maybe who's looking into getting into like a role like yours? What would you say to them?
Just be open. Be open to whatever they're gonna throw at you. Show that you can be ready to change on a dime. Like be ready to be adaptive and yeah, just be ready to be open.
Awesome. As we start to wrap up, Chris, is there anything that I didn't ask our volunteers and former volunteers that we should be talking about in this conversation?
I guess what I would ask is, what do you think the best advice for somebody on their first shift when they come in?
Ooh,
What is the
first
best
shift.
way for them to really utilize this program and make it work for them?
Ooh. Well, for me, I would say get familiar with your team. Just don't be afraid to say, hi, my name is, I'm a volunteer. What can I do to help you? And even if it's just, oh, could you go wipe down that table? Like that's going to take 10 minutes off of a therapist's day where they could be giving that to a patient. Like you said at the beginning, giving that time back.
Yeah. Jenna, what about you?
I'd have to agree with that. I feel like putting yourself out there, introducing yourself, meeting the staff that you're going to be working with, and asking what you can do to help. I think that's the best way.
You do get the best experience the more you put
Yep.
yourself out there. We try to encourage that. So
It happens in a lot of ways in life. The more you put into it, the more you get out of it. So
Agreed.
we're going to wrap up this interview. But before we do, Chris, if someone's watching this and they think, I want to volunteer, I'm a college student, or even just a general volunteer, how can they get involved and get connected with you?
we make it very, very easy. If you go to maryfreebed.com, up in the corner, you'll see volunteer pretty prominently in the upper corner. You just click on it. You choose the area you want. You can apply directly online. And then we follow up with a phone call or an email and get you started with the onboarding. And then the college students start 3 times a year. We have 3 semesters that we run, but the general volunteers start throughout the year, whenever it works. So it's an always running, never ending process. So we're always looking for new people. And I should also point out that we're also always expanding what we're offering for volunteers. We're working on new roles all the time. We have a peds hospital, I hear, opening in about a year and a half.
Yeah, you heard right. Yeah.
We're going to have more roles for that. So there's always going to be something new to do here at the hospital. So don't be afraid to put your name in the hat and see what you can come up with. We'd love to have people come back.
Awesome. Well, Chris, Jenna, DJ, thank you guys so much for being a part of this. And once again, we're talking about college student volunteers. Our summer session for this program has opened up. You can go to maryfreebed.com/volunteer to apply. So thank you everybody for watching and stay well.